Greetings, doctor. My name is Naomi Reddy, and I will be presenting on Meniere'S disease. So, this disease is primarily unilateral cochlear-vestibular organ disease in the inner ear, which usually affects the ear. But after some time, it tends to affect both the ears. It is caused by a buildup of fluid in the compartments of the inner ear known as the labyrinth. The labyrinth contains organs of balance, which are semicircular canals and otolithic organs. And for hearing, it is the cochlea. In this disease, the endolymph fluid in the membranous labyrinth builds up and interferes with the normal balance and the hearing signals between the inner ear and the brain. This abnormality causes vertigo and other symptoms. Attacks of dizziness may appear suddenly or after a short period of tinnitus or muffled hearing. Tinnitus means it's the ringing sensation in the inner ear. Some people may have it single attacks or dizziness separated by a long period of time, while some may have the attacks closer together over a number of days. For the function of the ear, as we all know that ears plays a very important role in our life. The major function of ear is to detect, transmit, and transduce sound. It helps us to maintain our senses of balance and hearing. The symptoms for this disease are sudden onset of vertigo, vomiting, ringing in ears known as tinnitus, temporary hearing loss, and also full congestion in the ears. The diagnostics for this disease is that during an attack, a patient may experience eye twitches in the direction of the normal ear. According to doctors, they refer this as irregular movement of, also known as nystagmus. Later, the twitching reverses to the other direction of the affected ear. In the low mid-range frequencies, hearing loss mostly affects tone that can be readily diagnosed by an audiogram. There's hypersensitivity in the equilibrium of vestibular organ if the disease is more advanced. The prevalence of this disease is that it it is global and it affects 12 out of every 1,000 individuals, and also 100,000 patients develop Meniere's disease. Not only that, 5% to 10% of the patients with vertigo are diagnosed with this disease. It is common for patients between the ages 30 to 52 kgs, and it is also commonly known among women than men. The treatment and prevention for this disease is attack reduction therapy, which means simple diet changes and prescription drugs. Though this therapy does not completely cure this disease, it only treats the symptoms. And as for surgical treatment measures, severing the respective balance nerve, and another one is removal of the labyrinth, which is the vestibule and the hearing organ, and this only happens to those who have already lost their hearings. And it is advised to limit salt intake, caffeine intake, alcohol, beverages, and also to practice regular breathing exercises and to also avoid loud noise. So that's it from me. Thank you.